Hola. Hola, buenas tardes. Vamos a finalizar las conferencias de hoy y la última conferencia corre a cargo del doctor Philip Morgan. Philip es Fellow por la Academia Americana de Optometría y también de la British Contact Lens Association, la BCLA, de Inglaterra, y es director de Oro Lens Research, que es una unidad de investigación y de optometría de la Universidad de Manchester. Your time. Gracias.
Okay. Buenas tardes. Hey, thank you. Good evening, everybody. It's a great pleasure to be with you again at this excellent meeting and to be in Barcelona again. I'd like to talk this afternoon about some of the important issues in contact lenses at the present time. And I guess what's important in contact lenses is a little bit subjective, but what I've chosen to do is to look at the major topics of discussion from this year's BCLA meeting, that's the British Contact Lens Association, and just to provide some information from that conference. Now, the BCLA conference, as you may know, is the biggest annual contact lens meeting in the world. Certainly each year many people, many colleagues from Spain attend the meeting. In fact, more people attend the meeting from outside Britain than from within. Most people are from overseas. Next year is in Manchester in the beginning of June, so if you've ever thought about coming to the BCLA meeting, next year is a good year to come. So I'm going to talk sort of about three things today. I'm going to talk about contact lens solutions. I'm going to talk about queratitis and inflammation of the ocular surface, and then some issues related to compliance with contact lenses and what we can do to ensure that our patients are being as compliant as possible. Now, another approach to considering what are the big issues in contact lenses at the moment is to look at, well, not just what we are interested in as contact lens practitioners, what are our consumers interested in, what are the other people in the world interested in. And if you go to Google, and specifically go to Google Trends, which is trends.google.com, you can put in any search term and look at when people have been looking for this search term over the last few months or few years. And if you look at the search term contact lens over the past 2 or 3 years, you can see in this upper line that there are some peaks of interest in contact lenses. And I'd like to say that the peaks of interest are when there's been some tremendous new contact lens development or when there's been some fantastic innovation in contact lenses. But unfortunately, there is great interest in contact lenses when there are reports of things going wrong. So what I'd like to reflect a little bit first of all is what problems have we seen with contact lenses, and are they really serious, or are they something really which we can to some extent ignore? And so we see that we have peaks of interest in contact lenses from the general population when there are some reports of some infections with contact lenses, A and E. And when something very positive happens, such as when the new bionic lens is introduced, then there seems to be less interest. People, unfortunately, are interested in bad news. But I think it's important for us to place this into context and to decide how important this is for us and for our patients. But this was an important issue at this year's BCLA meeting. This received a lot of interest and a lot of discussion, and it's something we need to consider, I think. So certainly over the past 2 or 3 years we've had reports of outbreaks of fusarium keratitis and also some outbreaks of acanthamoeba keratitis in different parts of the world. And it turns out that these are, although there's a lot of news information about these sorts of outbreaks, they're fairly isolated, they're fairly well demarcated in a population, and the number of people who are affected is in fact relatively small. But these things do happen, but we can use the information from these sorts of events, I think, quite positively. And these are positive in a number of different ways. Firstly, the epidemiologists become involved, and they look very closely at the people who are having these sorts of problems. And we can start to understand, well, who are the people who are having these problems, and is it something that they're doing wrong? And we can start to understand where improvements in compliance, perhaps improvements in how people look after their contact lenses, or clean for their contact lenses, or disinfect their contact lenses. Maybe there's ways people can wear their contact lenses more appropriately. So these sorts of outbreaks allow us to get this sort of, I think, very helpful information with which we can advise our patients. And so there are a number of publications based on these outbreaks where people have looked very carefully at those having the problems and giving us some important messages about how they can be best avoided in the future. And I'll be talking about this a little bit today. Other people get involved and make very clear reports about their perception. People from perhaps companies which were involved with some of these outbreaks and give a very clear report about why they felt it happened. And again, it's essentially positive information from overall perhaps a negative story. And thirdly, the third thing that happens is that the regulatory authorities get involved as well, and they improve some of we can improve the testing processes that we have to go through with contact lens solutions. So these outbreaks of infections happened over the last 2 years, and just this summer, this June, middle of June this year, in the United States, the Food and Drugs Administration, which regulates products, at least in that market, had a big meeting where a lot of people came in, discussed the problems that had happened, and from that they're most likely going to bring out some new guidelines about how products should be tested and evaluated, and this will inevitably result with better products. But we have to ask ourselves, I think, an important question. In general, are contact lens solutions giving rise to infections in our contact lens wearers? I've heard this said. I've heard people say that the problem with solutions is you get a lot of infections with solutions, and we've got to be very careful. So the question is this a sort of a general problem, or can these outbreaks of infections which have occurred be sort of clearly defined and demarcated and sort of put away and put to one side? We understand those, but they were local issues in unusual circumstances that are very unlikely to happen again, and in general everything is okay. So I think we need to explore that question. And there's various ways we can address this question. So the question is, are contact lens solutions associated with infections in a contact lens population? So what would be really nice would be to design a clinical study to address this question. And I think the way we would do that is, let's say, if we could invent any study that we wanted to, and we wanted to look at whether contact lens solutions were associated with infections, we'd recruit a number of contact lens wearers, maybe 1,000 contact lens wearers over here, and we would ask them to use contact lenses and also to use contact lens solutions. And we watch them very carefully, let's say for 5 years maybe, and we'd look at which of those people got problems. And at the same time, we'd have another 1,000 contact lens wearers over here, and we'd ask them to use contact lenses without solutions. Maybe they'd have to be daily disposable wearers. So we'd have a nice balanced experiment here with a group using solutions, maybe let's say monthly lenses replaced on a daily wear basis but using solutions, and some daily disposable wearers. And maybe we'd have 1,000 people in each group and we'd run a study for 5 years. That would be the perfect way to answer this question. The problem is that's a very difficult study to do. It's a study we'd need many thousands of people. It's too big a study. It's too expensive. So what we have to do is try and get this sort of information in slightly different ways. And the good news is that has been done. Epidemiology studies are conducted periodically where patients attend hospital with contact lens infections, and we can find out all about how they've been using their lenses and decide whether the use of solutions is a risk factor for infections or not. And there, I think, have been 3 reports of this sort of experiment over the last 3 years. And I'm going to tell you what they can tell us about infections and contact lens solutions. So what we're comparing here is monthly contact lens wearers with solutions with daily disposable wearers. So the key difference is between these groups is one group is using solutions. But we have to be a little bit careful. There is another important difference between these groups that we have to remember here, and that is that daily disposable wearers usually wear the lens on a part-time basis only. And so we have to bring that into our consideration of the results. So let's have a look first of all at what are the different wearing patterns between these lens types. And this is some information. It's actually British information that we've captured. And this shows how frequently these 2 different lens wearing groups use their contact lenses. And we can see firstly in the white bars that many daily disposable wearers only use their lenses for 1 or 2 or 3 times a week. They're only using their lenses on a part-time basis. On the other hand, if we look in the shaded bars with the diagonal shading, these are our monthly replaced wearers, and we can see that most of those wearers are using their lenses essentially on a full-time basis. In fact, they're using their lenses about 60% more frequently. And so, if we measure the risk of infection of these 2 groups, we might expect that the risk would be about 60% greater in the monthly wearers, because the daily disposable users only have their lenses in 2 or 3 times a week. So we have to remember that when we look at the data. But let's have a look at the data now from the various studies to compare these groups. So there's been 3 studies conducted recently in this area. And I'm going to make things a little bit easier for us to understand by assigning a risk of infection of 1 to people who are using daily disposable wearers. So the risk of getting an infection if you use daily disposable lenses is, we'll assign an arbitrary referent of 1. And what we want to see is, what is the risk of getting an infection in those people using solutions, in those people using monthly replaced lenses with solutions? And remember, we might expect, we could expect up to about a 60% greater increase just because those people are using lenses more frequently. That's what we would expect. But what actually do we find? Well, this first study did find an increase in risk of infection with people who monthly replace lenses, but it's only about 30% more. So that's about what we might expect. But these other two solutions found about a similar risk to daily disposables, or in fact, in this third experiment, a reduced risk of infection if you use monthly replaced lenses with solutions. And in fact, overall, this is a statistically significant finding. Overall, the risk of getting an infection if you use monthly replaced lenses with solutions is lower than if you use daily disposable lenses. So this, I think, has to suggest that overall, there is no risk, no associated risk of using contact lens solutions in terms of getting an infection. We can be, I think, quite sure that overall, if anything, the use of solutions is lowering the risk of infection. It's a very sort of positive result in terms of contact lens solutions. Now, another issue that sometimes comes up with solutions is staining. Sometimes we can get corneal staining with the use of contact lens solutions. You may have seen this. Usually it's short-term, transient, rather superficial staining that goes away quite quickly. But this is the sort of issue, again, that was discussed at great length at this year's BCLA meeting. Sometimes this is associated with the use of some multi-purpose solutions. And in fact, if we look at, this has been talked a lot about recently, and if we look at some market data, the use of multi-purpose solutions in yellow over the past 10 years in the United Kingdom, we've seen in this year a reduction in the use of multi-purpose solutions. So, another thing I want to discuss with you is, again, was this sensible? Should we see a reduction in the use of multi-purpose solutions? Because some people have associated some of these products with, again, an increase in infections. Well, we've just spent almost a year writing a paper on corneal staining. And what's really interesting about corneal staining is if you go away, as we had to do to write this paper, and look at all the literature that's related to corneal staining in contact lens wearers, or in fact, corneal staining more generally, there is very little information in the literature. I mean, here's a technique that we do many times a day or many times a week on most or on all of our contact lens wearers. And in fact, the scientific basis for corneal staining is not really well understood. In other words, when we see a little green dot on the cornea that we call corneal staining, we don't really know what's going on there. We can't really be sure exactly what's happening where that green dot is. And so there's, I think, a lot of uncertainty in this area, and we certainly shouldn't be looking at pictures of corneal staining and automatically making big jumps and saying, oh, this is a major risk for infection, when there is no evidence to suggest that that is. I just want to show you how good the cornea is at resisting infection, and show you an experiment reported by Susie Fleissig from her laboratories at the University of California at Berkeley. And she did a very simple but elegant experiment. She took 2 mice, and she wanted to look at how resistant is the cornea to getting an infection in terms of corneal staining. And on the first mouse, she actually put some filter paper over the cornea and removed the epithelium with this filter paper, and put bacteria on that cornea to see if it would get an infection. On a second mouse, she actually abraded through to the stroma of the cornea and added the bacteria. It's a bit of a nasty experiment, but it's important to help us understand what's going on here. So the question is, which of these 2 eyes gets the infection? And the answer is the second eye. Okay? So we can actually remove essentially all of the epithelium from the cornea, and the eye remains very resistant to infection. As long as the basal lamina of the epithelium is in place, the cornea remains very resistant to infection. So when we're thinking about very superficial levels of corneal staining, perhaps related to contact lens solutions, which are transient and rather superficial, and compare this to the fact we can almost remove the whole epithelium and we're unlikely to see an infection, I think this helps put a lot of this information in perspective, certainly for me. So I think we have to be confident with our contact lens solutions. I think everything I see, certainly for the multi-purpose solutions, is that these products do a good job and help our contact lens wearers reduce to very low levels the risks of infection. Now, I want to talk about, really now, why do we use contact lens solutions? What are they for? And the way I want to talk about this is to try and convince you that a contact lens wearer, in our contact lens wearers, there's a permanent balance going on all the time between two factors. When we use a contact lens, we might be adding extra bacteria to the ocular surface. Okay, we're adding more bioburden to the ocular surface. And all the time, on the other side of this balance, are the various ocular defense mechanisms. And usually, the ocular defense mechanisms win on this balance. But this is the sort of thing we have to consider with our lens wearers. Let's just look at this a bit more closely. So here's my balance. And on the one side of the balance, we have a range of ocular defense mechanisms. A whole load of things that prevent us getting infections. Because don't forget, our tear film and the ocular surface potentially is a very nice environment for bacteria. It's nice and warm, nice and wet, a sort of area where bacteria like to live. And yet around the room today, there's probably nobody with an eye infection, because the eye has a whole range of defense mechanisms. And let's just think what some of these are. Firstly, just the mechanical defense processes of blinking and tearing. So suppose I get a bacterium in my tear film. Well, I blink every few seconds, and the tears are being produced, and this bacterium is very likely to be washed away into my nasolacrimal duct. So just the mechanical processes of blinking and tearing rid the ocular surface fairly quickly of microorganisms. Also, the tear film, as you know, is full of antimicrobial agents. There are maybe 80 or 100 or 200 different proteins in the tear film, and many of these have antimicrobial activity. So we know of lysozyme and lactoferrin and the immunoglobulins and other proteins which will kill bacteria in the tear film. So it now becomes quite difficult for a bacterium to reach the cornea. It's going to get blinked away and teared away. It's got to fight through all of these proteins. And even when it gets to the epithelium, if it can reach the epithelium we know is covered with mucus and with a glycocalyx. And it's very difficult for a bacterium to adhere to the corneal epithelium. And even if it can adhere to the epithelial cells, we know that there is a rapid turnover of cells, and they become removed or sloughed from the epithelial surface very rapidly. And so it might reach the cell, but then the cell falls off the cornea and is washed away. So it's very difficult, in fact, for a microorganism to infect the cornea. And so normally, on the other side of the balance, we might have some bacteria, what I've called here bioburden. But the good news is that in just about all circumstances, the defense mechanisms win because they are so powerful, and it's very unusual to get an infection. But this balance can change a little bit in contact lens wearers, because my point is, even in a non-lens wearer, even if something happens like perhaps an abrasion of the cornea, usually there is enough power on the defense side of this balance to resist any problems. There are these multiply redundant defense mechanisms still prevent us getting an infection. But in a contact lens wearer, a number of things happen. A number of these defensive mechanisms become somewhat reduced. If we think about blinking and tearing, for example, that's a good example. If we have a microorganism now behind a contact lens, in a contact lens wearer, then the blinking and tearing process is much less effective because the bacterium is somewhat protected from these mechanisms. And some of the other processes are downgraded as well. But that's okay, because these defense mechanisms usually are so powerful that these things don't matter. But of course, very occasionally in a contact lens wearer, if we added a lot of extra bacteria or microorganisms to the ocular surface, then things can turn the other way. And this is where contact lens solutions come in, because contact lens solutions are effective in reducing this level of microorganisms that reaches the ocular surface. So contact lens solutions play a very important role in this balance, this process, to reduce the amount of bacteria that reach the ocular surface. And they're able to do this in, I guess, two different ways. Contact lens solutions reduce bioburden in two ways. Firstly, by cleaning of the lens. And we know that we can either be, with soft lenses, use a standalone, a separate cleaning sort of solution, or one of the multi-purpose solutions which have surfactant cleaners. All of these have properties to clean the surface of contact lenses. Now, of course, to do this properly takes a lot of solution, and it can take quite a long time. But we can see how effective this is, this cleaning process, at reducing levels of bacteria. So let's have a look at some data on this. Here's an experiment that was done 20 years ago. What happened in this experiment was these workers, they took a contact lens and they put 1 million bacteria on the contact lens. And they did two very simple things. Firstly, they just rinsed the contact lens of the bacteria, and they looked at how many bacteria were reduced by a simple rinsing process. And in fact, we go down from about 1 million to 3,000 bacteria. This is about a 2.5 log reduction. If we also then clean the lens with the solution, rub the lens, then this goes down to about 300. So the question is for our contact lens wearers, do we want them to put 1 million bacteria into the ocular surface or 300? Well, there's a question we really don't have to answer, but it just shows how important lens cleaning and rinsing is for our contact lens wearers to reduce this level of bioburden. It's really important. What about disinfecting? And I think that you know that we have some very effective chemicals that go into our multi-purpose solutions. These chemicals are used for, in fact, a number of things, including swimming pool disinfection, because we know that these sorts of chemicals are very powerful against bacteria, but they're, in fact, very gentle on human cells, which, of course, is what we want. So we can use them in swimming pools or in contact lens solutions. Now, I'm about to play a video in a moment with some audio. Is the audio working? Yeah, we got it? Okay. I recently had the opportunity to go and visit a contact lens solution manufacturer. I was interested to see, well, exactly how are contact lens solutions made, and how good is the process. I just wanted to show you a short video of how contact lens solutions are manufactured and processed. And I have to tell you, we start with a rather scary picture of me with a funny hat on my head. Let's watch it. We're now in the heart of the manufacturing process for contact lens solutions. All the main action is being taken place in the room behind me. You can probably see some people there gowned up. It's a very clean area. We're not allowed in there despite the fact we're obviously gowned up. It's important to remember that we don't just make contact lens solutions with normal mains water. The water has to be treated before it can be used as part of the contact lens solution. It has to be softened first of all. It has to undergo reverse osmosis to purify the water further, and it's also deionized. Even then, before the water can form part of the contact lens solution, the sterility has to be maintained by treatment with ozone. Behind me we've got some enormous 10,000 litre manufacturing vessels in which the water is added and all the various ingredients are mixed up to make the contact lens solution. Once that's done though, perhaps the most important part of the entire process is to filter the solution, and you might be able to see the metal tubes behind me. These are the filtration bed which make sure that the contact lens solution remains sterile before being passed through to the next part of the process where it's put into its bottles. So the process here is done in incredibly sterile conditions, and it was interesting to me to look at the sterilization was done with filtration. So here all the solution has to pass through very tightly wound plastic with very small holes of about 0.3 of a micron, and microorganisms cannot pass through these. So all of this, the bottles are now introduced. These are irradiated bottles, and they're introduced within this very sterile area. And we can see how the solution, having been mixed in these big vessels, is then placed into the bottles. All of this going on in these highly sterile conditions. Next we can see the nozzle being placed into the top of the bottle here, and you can see that there are lasers checking that all of these parts of the bottle are in place. Here we see the tops being screwed down onto the bottle. This, of course, is all done automatically, and the bottles now leave the highly sterile area. And you can see throughout the process we have agar plates checking for any contamination in the manufacturing process. Now, the bottles have to go through a number of quality checks. All of the bottles, in fact, get weighed to see that there is the correct amount of solution in them. You can see the weight or the mass of these bottles here. And occasionally, some of the bottles are incorrect and, hey, that's rejected. So the bottles now just move through the rest of the process from this very sterile environment, and they get the label on and put into boxes and shipped out. So I was impressed watching this process, how everything is incredibly sterile. Everything's done actually under high air pressure. So the room where the solutions are made, the pressure is relatively high to force air out of this environment into the surrounding rooms. In case of any bacteria in the environment, they're sort of forced out of this highly sterile area. So it's a very interesting chance. If you ever get the chance to see contact lens solutions being made, I suggest you have a look. Of course, the solutions have to undergo a range of tests to make sure that they're correct. So the quality control is also very impressive. Here we have solutions, firstly, I think, being tested here for their pH. Contact lens solutions have to be near to the pH at the ocular surface, about 7 units. The solution can also be checked for various components using spectrophotometry, looking at how light passes through, or UV light passes through the solution. We can have a visual test here. Also a test, this is for osmolality. We want to make sure that the osmolality is similar to the tear film. If it's more of a peroxide type solution, we can check for the concentration of peroxides using an automatic titration process as shown here. You might remember this, doing this at school. Of course, in a laboratory like this is all done automatically to look at the concentrations of peroxide. All very pretty. And in fact, this is the final sort of process. This is high-pressure liquid chromatography to measure the concentration of the components in the contact lens solution. We have to remember the components are very, very low. The concentration might be, for some of these components, maybe 1 part per million. And these are very difficult concentrations to measure, and we need sophisticated techniques to do this. Another interesting part of the quality control process with solutions is the microbiology, to test for the effectiveness of solutions in their microbiology. And so here's how we can test the microbiology, the effectiveness. Here we have some bacteria, some Staphylococcus aureus, and we add these bacteria to some of the contact lens solution. So we've now got a mixture of bacteria and solution. This mixture is then diluted down in order that we can measure for bacterial growth left in the solution. So this is the dilution process. And then we put the solution onto an agar plate, spread it around. So we've got this mixture now of the contact lens solution and the bacteria on the agar plate. This has to be incubated for a number of hours, and then we can look at for any bacterial growth. So every step of the way in this manufacturing process, there are, I think, incredibly high levels of quality control to make sure that the solutions we get are of appropriate quality. And we know that the solutions we have on the market, to be put on the market, have to show efficacy against a range of microorganisms. These contact lens solutions have to be effective against 3 bacteria and 2 fungi. And all the solutions we have on the market meet these very high standards. So again, we can be quite confident that what we have available to us is very good at killing all of these bacteria. Now, we've seen, I think, a lot of discussion recently about hydrogen peroxides and should we move from multi-purpose solutions to hydrogen peroxide. And it's interesting to look at the data of infection risk between the multi-purpose products and the peroxides, because it's not clear to me that this would be a sensible move to make. Certainly, if we look at the epidemiology data, it would suggest that the multi-purpose solutions do extremely well. This is data for the likelihood of getting an infection in contact lens wearers, split by different sorts of solutions. And this is a very difficult experiment to do because of because contact lens infections are really very rare. So to be able to get good data by solution type is rather difficult. But these people in their study were able to do this. And they said, okay, firstly we have a 2-step peroxide. We don't use 2-step peroxides very much now. But let's say the likelihood of getting an infection with a 2-step peroxide system is 1 unit, 1.0 unit. If we compare a 1-step peroxide, then the risks of an infection are about 3 times greater. What about the multi-purpose solution? The risks of getting an infection with a multi-purpose solution versus a peroxide. Perhaps I'll have a show of hands in a moment. So the risk is either higher with a multi-purpose solution of getting an infection or lower compared to peroxide. So who thinks the risk of getting an infection with a multi-purpose solution is higher than with a peroxide? Multi-purpose solution, peroxide. Who thinks it's lower? Okay, most people higher, a few people perhaps a little bit at the end of the day now. In fact, in this experiment, it was lower in the multi-purpose solutions than in the peroxide groups. So, again, we can be confident that these modern multi-purpose solutions are very effective. The last group they had was chlorine. Now, I think very few people are using chlorine now. And I think it's looking a bit bad for chlorine because this axis goes up to 50. And in fact, the risk of using chlorine is very high. Okay. I want to finish off. Again, another major topic of discussion at the BCLA this year was keratitis and what we can best do to reduce the likelihood of keratitis in our contact lens wearers. As you know, this can present very differently, a big range of keratitis potentially. And over the years, people have produced data like this to say, well, what are the risk factors for getting a keratitis? So we know, for example, smokers are more likely to get keratitis with their contact lens wearers than non-smokers, about a 50% increase in risk. People who buy the lenses from the internet are more likely to get keratitis. A range of things where people are incorrectly using their contact lens solutions, all the way up to people who are sleeping in their lenses. So here's a load of risk factors which make our wearers more likely to get keratitis. But I think this is only half of the story. I think we need to know these risk factors, but we also need to understand how frequently are people doing these things incorrectly. So I think this is not just a one-dimensional problem, it's a two-dimensional problem. And I think this is very helpful in telling us how we can best advise our patients. And in a recent study, we asked about 1,400 contact lens wearers from all over Europe about 15 different steps of their contact lens care. So we asked them how frequently they use their lenses. Did they sleep in their lenses? When they're using their solution, did they always throw away their solution every morning and use fresh solution? Did they always put the top on their contact lens case? Etc. These 15 different steps. And we looked at how compliant they were with each of these steps. And we're able to construct a chart which plots the level of non-compliance, so how badly behaved our patients are, against the risk of getting a keratitis. And I'm going to color code this chart here. Because parts of the contact lens care process which are up here, we have to be more concerned about, because anything which appears up here, people are doing badly, so most people are not doing this step correctly. And also things that are up here are associated with a much higher risk of keratitis. For example, hand washing. Now, different people have reported slightly different risks of not hand washing, or the different risks of getting keratitis by not washing hands. So one report, Stapleton, has about a 5 times increase. So it's about a 5 times increase of getting keratitis. This other report has about a 1-fold increase. So this is the range of getting keratitis if you don't wash your hands. And we know from our survey this has a non-compliance rate of about 30%. Okay, so about 30% of people are not washing their hands, and by not doing so, they're having between a 1 and 5 times increase of getting a keratitis. So this is why it appears here on my chart. But we can do this for all 15 steps of the contact lens care process. And this is a little bit complicated, but what we need to be looking at is which steps on this chart are in the red areas. Because if they're in the red areas, we can easily advise our patients against this behavior, and in doing so, probably reduce their risk of keratitis. So let's have a look at a couple of the things in the red areas. Over here, care of the contact lens case is usually not performed by our patients. Our patients do not clean their case and do not throw away their case. And these sorts of behaviors are associated with a clear increase in risk of keratitis. So here's a couple of easy steps we can have with our patients to advise them about case care. Rubbing and rinsing is also in the red. So most people do not rub and rinse their contact lenses, and this is associated with increase of risk of keratitis. So here's another thing for us to do. Perhaps the other main areas are sleeping in lenses and using the correct solution. So to some extent, all of these other behaviors we can, to some extent, ignore. We only have a short time with our patients, and we have to be as effective as possible in advising them. So these would be my priorities when when talking with a contact lens patient. This is where we're going to, I think, be most efficient in advising them on their lens care. So looking after their case, cleaning their case and throwing it away. Making sure they're cleaning lenses and rinsing them. Making sure they're not sleeping in lenses, at least without us knowing, because they are sleeping in lenses. We need to make sure they're using the best materials, a silicone hydrogel material. But making sure they're not sleeping in lenses without telling us. And making sure they're using the correct storage solution. And you can see how these priorities reduce down all the way to things which, in general, people do well and are not associated with a big risk of infection. I think this is in your handout. So I think they're the main issues of the moment, in my estimation, at least according to what's being discussed at the BCLA conference this year. We have various issues with solutions, but to me, our solutions do a great job. They're manufactured to very high standards, and they protect our patients from infections. No doubt about that. Sometimes our patients don't do everything that they're told, and I think there are some key areas which we can highlight to advise them to reduce the risk of them getting problems. That pretty much brings me to the end. I'd like to thank the organisers, Inma Perez-Gomez in particular, and to Elisenda Ibanez. And thank you all for your attention. I hope you've enjoyed your day, and thank you for the invitation. Thank you very much.